With a steady gaze, Brian Griffin of Albertson is chomping at the bit to get his day of farming started.
Today's rainy, cloudy, but he's pushing his corn out of the fields.
It's going to be a long day of hard work, and the 55-year-old is more than happy to do it.
My product is good. I feel better. It's amazing what they can do.
Earlier this year, Brian thought he just had a cold and went to the doctor's office, only to find out he had a couple of clogged arteries and needed stents. For the first one, he had the traditional surgery.
It was a little difficult to deal with.
While his first surgery was successful, for his second surgery, he underwent the new TCAR procedure with ECU and Vidant Health.
TCAR, transcarotid arterial revascularization, is a novel approach to traditional carotid stenting. It brings a new technology to the patients of Eastern North Carolina, reduce stroke risk, more minimally invasive, lower risk of nerve injury, and lower risk of long-term complications. So the procedure starts with an incision over the collarbone of the affected side. We then are able to insert a cannula directly into the artery and then a separate cannula into a vein in the groin. And then through this, we initiate the flow reversal. This prevents the debris from embolizing to cause a stroke. It also allows us to safely place the stent without having to worry about dislodging anything that can go and cause a stroke. The blood that's extracted through the artery is then filtered and reinserted back through the vein. And by doing this procedure, we eliminate any of that plaque from further embolizing during the stent placement. And that's where the decreased incidence of stroke has been noted compared to traditional stenting or open revascularization.
Brian says his TCAR procedure went very smoothly.
I highly recommend it for anybody.
Thanks to his new stents, Brian is back to work, and hopefully for a long time to come.
I'm happy to be here to see the field and the crops is growing.